Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, and welcome to this episode of the Anti-Aging Insights podcast. Thrilled to have you along. Today, I have a special guest along with me today, Dr. Christina Han, and she is a dermatologist and the medical director at XYON. And I'm thrilled to have her on today to be speaking about hair loss, particularly for men today. We'll do a women's episode in the future. But Christina, thank you for being here. I'd love for you to take a moment and introduce yourself.
Thank you so much, Teri, for having me. So I'm Christina. I'm a dermatologist. I've been in practice now for 12 years, and my practice is very much focused on medical dermatology and surgical dermatology. And one of the areas that I'm passionate about is hair loss. And so hence why I am in a medical directorship role at XYON. I'm also a clinical assistant professor at the university here and love to just educate. So that's why I'm here today. So let's dive right in.
Amazing. Well, many of the listeners will know somebody or may have some challenges with themselves with regards to hair loss. And so maybe we can just start with the basics in terms of why is this a problem? How common is this problem? A little bit of the background information on male pattern hair loss.
Yeah, absolutely. And you're right. This is very common. It can start very young. About 20% of men can start having it in their 20s. And it's actually thought that 50% of men by the age of 50 will experience some thinning. And this continues to progress as we age, unfortunately. And so this is only talking about male pattern hair loss. There's obviously lots of causes to hair loss in general, but hair loss in general is a devastating thing for most people just because it is so closely linked to our self-image. And it can be really devastating to see that receding hairline or thinning. And so this is something I see every day. And certainly there's help out there because there are treatment options, and more of these types of conversations actually need to happen so that people can know that there are treatments out there.
So that's great. So let's dive right into that. So let's say there is a man out there and he's looking at his hair and he's saying, oh, this is thinning, or I've got a receding hairline. And they come and they speak to you. Here's my concern. How do you approach that? What do you do?
Well, first of all, I do a good medical history just to make sure that this is what we're dealing with and that this is a genetic form of male pattern hair loss. This is, as I mentioned, a genetically driven process. So I tell them that, usually we can't change our genetics, but we can certainly try to halt the progression and even try to grow new hair. So, of course, going through the background medical history, medications, what they've already tried, their family history, and other important factors like their diet also come into play as well, and just their overall health, because our hair and our skin are closely linked to all aspects of our health. And then, of course, I dive into some of the treatment options that are out there, usually prescription, and that will kind of depend on what their lifestyle and their wishes are when it comes to topical or oral treatments.
Great. Yeah, and we'll definitely get into that. I have an interesting question here. That's something that keeps coming up a lot. People always say, I don't understand. My dad has a full head of hair and I don't. How much is the genetic component relevant here? Or is that a misconception? Or what are your thoughts on that?
Yeah, that's a really good question. I get asked that all the time too. And it's true that it is a little bit of a misconception because I think historically a lot of people would say, oh, it's the mother's side or the father's side. But actually it is polygenetic, meaning there is not just one gene that is passed down from one side. It's likely multiple genes that are at play. And so it's unfortunately not that predictable based on the lineage of your family history. But certainly if there are more members in the family that are afflicted with thinning hair or balding, the chances are going to be higher that the given individual may suffer from that as well.
Okay, there we go. Now we've answered that question once and for all. Fantastic. So next steps, this man has decided, okay, yeah, I want to do something for my hair. What are the treatment options that you can suggest? Maybe you can go into a little bit of them, how they work, that sort of thing.
Yeah, absolutely. I think many of us have heard of Rogaine. Rogaine is a brand that is topical minoxidil. And that is one of the 2 treatment options that are currently approved for male pattern hair loss. Rogaine or topical minoxidil comes in 2 percentages currently in Canada, 2% and 5%, in either a lotion or a foam. And for men, I generally recommend the 5% twice a day, every day, until they decide they don't want to treat their hair anymore. So that is the first option that is currently Health Canada and FDA approved. And then the second option is oral finasteride. Oral finasteride is a pill, and this is a tablet that's taken once a day. And again, this is something that that individual will likely need to commit to in order to try to maintain and restore their hairline. They're two different drugs. They work totally differently, and I'm happy to go into that. But these are going to be the first two things I will offer as treatment options.
Is there a simple way that you can explain how they each would work so people have an idea of what the difference is between those?
Sure. Yeah, absolutely. So minoxidil topically works by likely prolonging that anagen or growth phase of that hair cycle. So to step back a bit, every hair on their scalp is in a cycle. So it's either growing, resting, and then transitioning to shed out. And then again, that cycle starts again. And that's normal. A hair follicle is always in some point of that cycle. And of course, every follicle on our scalp is at a different phase of that cycle. And so minoxidil is thought to prolong that growth phase or that anagen phase. And as a result, more of that follicle's time is spent growing a hair rather than resting and falling out. Another way that it works is probably by promoting dilation of the blood vessels in the scalp. And that's a good thing in general because it allows for more oxygen and nutrient delivery to the level of the hair follicle. And that also can help promote growth factors and more hair regrowth. So that's actually the thought. But interestingly, minoxidil wasn't known to do that until they started giving oral minoxidil for that vasodilatory effect in cardiac patients. So that's actually where it first got discovered, was to lower blood pressure by dilating blood vessels near the heart and in our body to lower blood pressure. And so that's how actually Rogaine came to market, was because they saw that these cardiac patients started to grow hair.
Oh, that's interesting. Huh. Very cool.
And then finasteride works completely differently. It works at the level of an enzyme that is responsible for converting testosterone into another form of testosterone called DHT. Now, DHT is likely the main culprit in what causes male pattern hair loss. And what's happening is actually the follicle is getting miniaturized over time because of signals from that DHT. And so ultimately that follicle is no longer a big, robust follicle that's able to grow hair. It actually becomes so miniature that it's not able to grow a normal terminal hair. And so finasteride is classified as a 5-alpha reductase inhibitor by blocking that conversion into DHT.
Interesting. Okay, so that's great. So there's two different ways that you can work on the hair. Now, one of the issues with some of these, particularly the latter medication, is that people take it orally. There are some side effects that potentially that can occur, correct?
Yeah, I mean, it's fortunately not that common, but I certainly will encounter it in some of my patients. And those are really mostly sexual dysfunction related side effects. So any sexual dysfunction you can think of can unfortunately occur with oral finasteride. And that's simply related to the hormonal effects that this medication can exhibit. And as a result, some men can experience decreased libido, decreased erections, changes actually to ejaculate fluid. So you name it, all of it can happen, unfortunately. But the good news is it's not that common, and it is considered reversible with discontinuation.
Now, what if there was a topical versus an oral way of getting this medication to the hair?
Well, that's great, because that's actually why I've partnered with this company called XYON. XYON Health is really looking at innovative ways to deliver treatments like this. And one of them is topical finasteride. So we talked a little bit about topical minoxidil, and it makes sense that you want to deliver medication to the follicle, and we don't really need it in the rest of our body. So that's the exact premise of XYON Health. Topical finasteride, let's deliver it to the scalp and the hair follicle. We don't need it in the body, and hence the potential for reducing side effects. So that is one option out there at XYONhealth.com. Many patients are electing to use topical forms to really lessen this potential for side effects.
So that's great. And of course, I knew that, and we're thrilled to be able to offer the XYON products at Anti-Aging. one of the really interesting things about that to me is your delivery system. And I wonder if you can actually talk about that, because I think that's really innovative. And I think it'll be really interesting to people that are considering a treatment for their hair loss.
Yeah, it's actually super exciting. It's physician formulated and it's proprietary to XYON's technology. As a dermatologist, one of the most important things when we apply to the skin is actually the vehicle or the base that medication is being applied to. And Siloxysystem gel is this gel that XYON has that can compound in active ingredients like finasteride to apply to the scalp. What's great about this is that we've done research studies looking at how it stays on the skin and is able to retain at the level of the skin. And we've also looked actually at how much medication gets absorbed using Siloxysystem gel. Specifically, we want it to be limited into the body. So measurements on drug levels as well as level of DHT suppression were also looked at in actual clinical subjects. I'm really excited to be part of this brand because I do feel that they are really science focused and innovative in delivering safe and effective treatments.
That's fantastic. Well, I think that's a great overview then of male pattern hair loss and some of the treatments that are available, some of the innovative treatments that we have at Anti-Aging and that we have in partnership with you, XYON. It's really great. Things are obviously constantly evolving and the research is there to support it. So that's fantastic. I want to thank you so much for joining me on the podcast, Dr. Han. And I also want to give you an opportunity to tell the listeners, the viewers, where can they learn more about you if you want to share a social media profile, or again, links, again, if you want to mention to XYON where they can learn more about that as well.
Oh, of course. Thank you so much for having me. It's been a pleasure. You can find me on Instagram at The Medical Derm, or also XYON stuff are available at XYON Health. So XYON Health.com. And it's actually a great service because patients can go there at their comfort of their own home, go through a specialist consultation online and learn more about some of the products that we have. There's also over-the-counter or retail-ready products that I know you carry at your clinic, but you can also purchase and add to cart online as well. And that's all available at XYON or XYONHealth.com.
Fantastic. Well, again, thanks so much for joining me and educating our listeners about hair loss. We'll have to do this again sometime. I think we should do one on women's hair loss as well. I think that'd be a great topic.
Yeah.
And thanks again. I appreciate your time.
It's been so much fun. Thanks again. Until next time.
There you go. I hope you enjoyed that episode with Dr. Christina Han. Lots of great information there on male pattern hair loss. Again, I encourage you to check out all the resources at XYONHealth.com. And as well, if you want to discuss some of these treatments, as well as some other treatments for hair loss, I am happy to have that discussion with you, of course, at any time by checking out our information at antiagingvancouver.com or on my personal website at drterifisher.com. As well, you can reach me on Instagram. Happy to chat with you there at Dr. Teri Fisher. A huge thanks again to Dr. Han for spending some time with us and helping to educate all of us a little bit more about hair loss, which is a very, very common condition. Thank you to you, listener, for tuning in this week. I hope you got a lot out of this episode, and I look forward to speaking with you again really soon. Until then, take care.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.